Hello, UNCW Admissions Committee. My name is Jennifer Walker. I've been a registered nurse since 2015, and I'm applying to the AGPCNP program at UNCW on their DNP track. My understanding of the differences between MSN and DNP is that MSN is the entry level required to be able to practice for patients and provide care for them safely. It's a wonderful degree, but I am more focused on the DNP degree. I understand that to be a terminal degree, and that with that degree, I'm going to be able to affect changes at a higher level, such as the system or population level, to really have a positive effect on patient advances. Like I said, I've been a nurse since 2015. My history is that I started off in the cardiac progressive care unit, and then I transitioned into the pulmonary progressive care unit. Those really started my leadership. With that, I also did the charge RN position and was in charge of all of the in-services, did the scheduling, lots of things there. I've also served as an associate clinical director for assisted living buildings. That was fun, but I knew that that wasn't for me, so I did come back to school. And the last leadership role I had was actually with my current employer with Liberty Hospice, and I was their Hope champion. So Hope was a new thing that rolled out with hospice and Medicare reimbursement. So I was able to take that education and receive it myself and then roll it out to my specific branch in whatever way that I needed to do so. And it was successful, so that's good. So my professional experience does have leadership. I'm also very well versed in autonomy. As a hospice case manager, I practice autonomy all the time. I'm out in the field and my providers are a phone call away, but I'm the only one that's in there in the house at the same time. I love education. I'm a big dork. I have a desire to learn and to teach new nurses. Part of the way that I'm doing that right now is participating in the CCHF at UNCW. I'm one of their fellows, and so I just found out who my mentee is going to be tonight, so I'm very excited to get that going and help that person through nursing school. I've set myself up for success for this program by having relationships in the community that I think that I can go to if I have any questions or concerns, or look for any preceptorship opportunities. They're in primary care offices, in skilled nursing facilities, and all of that kind of stuff. And I've known these people for many years, so I think that this is setting myself up for success for that. My personal attributes are that I'm kind. I'm always kind. I always give people the benefit of the doubt. I'm also diplomatic. I try to see all sides of every story. And I've been told that I'm very personable and adaptive. I'm very good at reading the room and then changing what I need to about myself, or assessing what that particular situation needs and being able to respond in kind. A long-term goal that I have right now is to continually recognize my blessings, because there are a lot of them. A long-term goal that I've completed in the past was I ran a half marathon that required very many months of practice and was well worth it. The DNP aligns with my professional goals because I kind of want to delay the entrance of some people to hospice. In my experience, I've seen patients enter this program for lack of primary care, not understanding how to take their medicines or how to change their lifestyle, and being able to really be the provider that spends that time with them and try to make that connection with them. I can help them learn through those chronic diseases and manage their healthcare better, and their families. The DNP is going to set me on a path to discover research and different ways of thinking to achieve this goal. So I hope that this helps you understand about me a little bit, and I'm very excited to being a part of this program and giving all I have to North Carolina and New Hanover County in this area. Thanks. Bye.